Well, tonight marks a crucial deadline for millions of Americans who rely on the Affordable Care Act. Enrollees must select a plan of coverage beginning for January 1st. But this year, many are facing higher health insurance premiums after Congress failed to extend subsidies. 11 Alive Doug Richards spoke with families now preparing for those higher costs.
I've got multiple autoimmune conditions and connective tissue disorders.
Himali Patel of DeKalb County says she spends an inordinate amount of her time in front of healthcare specialists.
So I've got multiple autoimmune conditions and connective tissue disorders. And last year I was diagnosed with cancer.
She has been an Affordable Care Act customer for more than a decade. Her newest out-of-pocket premium for ACA coverage was a shocker.
My premium is actually quadrupled. More than quadrupled.
And that's because she and hundreds of thousands of other Georgians have lost a COVID-era subsidy. Congress has declined to extend it as part of a partisan power struggle at the U.S. Capitol.
My cost per month is going up by $1,300. That's $15,000 a year.
Angela Holmes of Macon is another ACA customer, observing the bickering in Washington and eyeing how it's affecting her family budget.
It's very, very scary. I have two major conditions, which mean that my health care must be continuous and it must be good coverage.
Holmes says it presents a stark choice, giving up on health care or facing medical bankruptcy.
I simply can't afford the premiums that it would take to get the level of coverage that I need.
The Affordable Care Act was designed to be affordable.
15 years later, they say no more. Doug Richards, 11 Alive News.
Now, House Republicans are set to vote this week on their version of a health care bill. Now, the legislation does not include premium assistance, even though lawmakers could still consider an amendment to extend those subsidies.